Friends, I am Dr. Sir Jeffcoate. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for leucorrhea or white discharge. First, some introduction. What is leucorrhea or white discharge? To start with, each must know that there are plenty of glands and microbial flora in the uterus and vaginal canal of the female, and most interestingly, these two organs are self-cleaning. So, vaginal opening always show more or less secretion. However, this secretion is not much. Neither has it any obnoxious odor or itching or corroding property. This is a natural, bland, healthy discharge which is washed out during daily toilet use. World famous Sir Jeffcoate said, oozing out of too much whitish, greyish, greenish, yellowish secretion from vaginal orifice is called leucorrhea. Though many body call this white discharge, it may not be white at all. It will be greyish, greenish, yellowish, different color. Consistency may be fluidish, creamy, jelly-like or cheesy. Generally, it is malodorous and has got itching property. On the right hand side, the image of uterus has been displayed. These are the vaginal canal. This is uterus, the internal canal of uterus. From this uterus internal wall and vaginal wall, oozing always comes. Will always come. It is natural. This is not leucorrhea, as already just discussed. What are symptoms of leucorrhea? Number one, weakness and malaise. Other symptoms actually, itching in about vaginal opening, pain in waist, legs and abdomen, burning during urination and frequent urination, irritability and lack of concentration, malodorous discharge, sex desire may increase or die out, indigestion. What are the causes of leucorrhea? Any reason that may change the healthy bacterial flora of uterus and vaginal canal may cause leucorrhea, bringing about change in color, consistency, odor, nature and quality of healthy and natural vaginal fluid. Following are some of the reasons. Number one, use of antibiotics, steroids, and birth control pill. Number two, bacteria, fungal vaginosis, sexually transmitted disease, infections or diseases, pelvic inflammatory diseases, cervical cancer, post-surgical pelvic infection, diabetes, loss of equilibrium in pituitary hypothalamus ovarian axis, use of douches, scented soaps, lotions and antiseptics in or around vagina. Last point number 8 was capitalized, rather big, and not capitalized but in higher fonts and underlined, because this is very important point. Many of us do not know this. There's use of these things can cause leucorrhea. The vaginal area, the vulval and vaginal area should always be washed with bland, lukewarm water or at best saline water. That is 0.1%, 0.1% saline salt water. That is called saline water. This is at best. No scented soaps, no lotions, no antiseptic, nothing which may be described in the advertisement as very nice, very good, very scented. All these are damage. All this will cause damage to the vaginal wall and uterine wall and may cause many trouble. One of the common trouble is leucorrhea. Mind this. So, on the right hand side, this has been shown, various types of thing used by this to around vaginal wall or vagina or vulval region, that has been crossed out. How to prevent leukorrhea? Number 1, keep vagina clean using plain warm water or at best 0.1% saline water. While using mops, the direction of mop should be from anterior to posterior, that is from vaginal opening to anus. The picture has been shown side. Never use any scented soaps, antiseptic around vagina, douches in vagina. They are harmful for your health. Drink 2 liters water a day. Take enough fresh veggies and fruit daily. Take complete grains, not refined things. Take low fat, white meat, fish, eggs. Avoid saturated fat, salt, sugar. Shun all types of addictions. Trans fat strictly. Avoid too oily, spicy foods. Do not allow mental stress to accumulate. Get quality sleep for 7 hours daily. Take at least 20 to 30 minutes of physical training, or that is physical exercise, so that a few drops of sweat appear on the forehead. This is a very important thing. Very, very important thing. Basic things. Now, medicines. Natrum muriaticum for leukorrhea. Generalities. First, we'll give symptoms of the person, then particulars, that is about disease itself. Generalism, persons. What is the type of person? Prone to weeping alone, emotional to books, plays, other pathetic things, worse from sympathy, sensitive to rudeness, criticism, humiliation, fuss. There is natrum muriaticum patient cannot tolerate this thing. They cannot tolerate rudeness, criticism, humiliation, fuss, great desire or aversion to salt, aversion to bread, fats, crack in the middle of lower lip. This is also seen in sepia also. Note this this is crack in the middle of the lip. This is seen in sepia and natrum muriaticum. Particulars. Profuse, thick, white, transparent or yellowish or greenish discharge, especially while walking in the morning. Important thing, in the morning. Leukorrhea with headache or colic or mucus diarrhea. Discharge acrid with itching and smarting of vulva. Bearing down pressure as if uterus would come out of vagina. Cutting pain in urethra after urination. Aversion to sex. Irritable mood after sex. Thuja occidentalis for leukorrhea. Generalities. Adapted to hydrogenoid constitution of grovel. Hydrogenoid means this person gets aggravated in a wet or damp weather or places which is beside sea, big lakes, rivers, there is water. From maltreated or suppressed gonorrhea. Acts well in persons of lymphatic temperament with too much hair on body surface, or persons of psychotic or syphilitic origin. Note this is the back of a person. This is Thuja patient. Too much hair, body hair too much, where there should not be, generally should not be hair. In Thuja cases, patient, hair will be also there. Fixed ideas like a living animal were in the abdomen, as if soul and body are separated, as if being under a superior power. Music causes weeping. These are peculiarities of Thuja patients. Particulars. Leukorrhea runs from one period to the next. Note the particular symptom. Leukorrhea runs from one period to the next. Mild discharge with burning pain in left ovary. Worse by walking, riding. Also mucus discharge from urethra. Swelling of labia with burning pain when touching and walking. Cramp-like pain in vulva and perineum extending up to the abdomen when rising from a seat. Stinging, burning, with urinating, great sensitivity of vagina. Graphitis for leukorrhea, generalities. Adapted to fat, corpulent lady with habitual constipation and delayed menstruation. Generally sad, despondent, timid, hesitant, indecisive, cannot tolerate music, weeps on hearing. This is peculiar symptom, mind. Graphitis patient cannot tolerate music, generally they start weeping. Takes cold easily with proneness to crack or fissure on tips of the finger, nipples, labia, anus, between toes. Decided aversion to coercion. Graphitis patients do not always try to avoid sexual intercourse. Particulars: acrid, excoriating, thin, watery leukorrhea occurs in gases day and night with weakness and opaque. Appears before and after menses, before sepia, after creosode. That is, these symptoms, menses, leukorrhea before, after menses, before menses, before menses, after, before sepia, after menses, creosode. Here, before or after, both, in case of graphitis. Soreness and rashes of labia, on labia, worse in the morning, rising from bed. Induration and congestion of cervix, watery eruptions on cervix. Sepia for leukorrhea, gelatis, yellowness of the face. Look the face of the sepia patient, yellowness of the face, conjunctiva, yellow spots on face, chest, a yellow, white, yellow saddle-like impression, both sides, on nose, saddle-like impression across upper part of the cheeks and nose. Great sadness and weeping, fear of being alone, of men, furs, meeting friends, indifferent to one's own family, to one's occupation, to those whom she loved best. This is the sepia patient. Particulars: leukorrhea with sticking pain in uterus, much itching in vagina and vulva, sensation as if everything in lower abdomen would come out of vagina. Sits with crossed leg to prevent, that is, prevent coming out. Leukorrhea worse after coition. Milky leukorrhea only in daytime. Post-gonorrheal induration of cervix. Induration means hard, being hard. Cervix, the opening of the cervix, face of the cervix becomes hard, indurated. Uterus enlarged, indurated, and retroverted. This is retroverted uterus. This is retroverted uterus. This is antiverted. This is healthy. This is unhealthy. This retroverted uterus, generally with time it comes out. That is, prolapse of the uterus occurs. This is very painful disease. Sepia can stall it if it is given in timely. Sabina for leukorrhea. Generally, it is chronic ailments of women, arthritic pains. That is, this patient suffers from arthritic pain, tendency to miscarriage, especially at 3rd month. Music is intolerable, causes weeping. Thuja graphitis, also the same symptom. Drawing pain from sacrum to pubes. Particulars: leukorrhea with amenorrhea, jellylike, yellowish, ichorous and fetid, offensive smelling milky leukorrhea causing itching of pudendum. Leukorrhea during pregnancy and confinement with intense itching and soreness of thigh, increase of sexual desire, indescribable uneasiness and restlessness in lumbar vertebra, and drawing pain from fundus uteri through pubis and genitalia, like labor pain. Gelsemium, best for subacute cases. Generalities: general depression from heat and summer, weakness and trembling of tongue, hands, legs, virtually all parts of the body. Desire to be quiet, to be left alone, does not wish to talk to or allow anyone near him, even if person is silent. This is also seen in Ignacia patient. Great heaviness of eyelids, cannot keep them open. This heaviness eyelid cannot keep them open, also seen in causticum, graphitis, syphilinum, sepia, specially adapted to nervous, excitable, hysterical female, to ailments from masturbation with great depression of spirit and excessive languor. Particulars: sensation of heaviness in the uterine region with leukorrheal discharge, feeling of fullness in hypogastrium and aching across sacrum. Now hypogastrium. Now what is hypogastrium? Our abdomen in medical science has been divided into nine parts. The parts, name of the parts and the area has been shown in the right hand side picture. This nine parts, this part, 1, 2, 3. Right hypochondrium, epigastrium, left hypochondrium. This is right hypochondrium, epigastrium, left hypochondrium. Right lumbar, umbilical, left lumbar. These three. Then right iliac, hypogastrium, left iliac. These three. Now here, feeling of fullness in hypogastrium, that is this region. And aching across sacrum. Actually, in gelsium we got much generalities, symptoms, particular symptoms, very few, and nothing extraordinary, something. But generalities are very, very important. Strategy for leukorrhea, generalities, chilly patient, yet sweat, much around head, hand, toes, feet, axilla, offensive sweat, fit for scrofulous patient, wants vital heat, always chilly, even when exercising. The silicea patient wants a head covering even in summer season. Great weariness and debility, wants to lie down always, cannot perform mental labor, feels fatigue. Particulars. Painful smarting leukorrhea during urination, milky leukorrhea in paroxysm preceded by cutting pain around umbilicus. Umbilicus has been described already just in last slide. Sanguinaria for leukorrhea. Here it is. Adapted to climatic disorders. Pain wherever it is increases and decreases with sun. Increases and decreases with sun. As the sun rises and going to mid sky, it is increasing. Then from mid sky to western horizon, then decreasing. This is also same. Increasing, decreasing. It's a right-sided medicine. Sanguinary is right-sided medicine. Sick feeling and fainting from fragrance of flower. See, fainting from fragrance of flower. This is very peculiar symptoms. Fainting from fragrance of flower. Feeling better from sleep, lying on back, hot flashes over whole body ending in faint feeling. Particulars. Climacteric disorder, likewise. Climacteric disorder, this term is coming very often. Climacteric disorder means disorder after the end of the menstruation age, that is after 45 or sometimes 42, 43. This time is the climacteric age when the menstruation ceases naturally. Orders after that period is called climacteric disorders. Like flashes of heat, fatigue, acrid leukorrhea, soreness under right nipple, leukorrhea after climaxis when menses cease completely, distension of abdomen in the evening, flatulence discharge after vagina coming out of os uteri. Borax for leukorrhea. Generalities. Patients are excessively nervous and easily frightened by slightest noise or an unusual sharp sound like firing matchstick, cough, sneeze, etc. This symptom is also seen in caladium and asarum. Particulars. Leukorrhea just midway between two menstrual terms. Albuminous, white discharge like white of eggs and starch with sensation as if warm water escaping. Perfectly bland and painless. Stitching and distended feeling in clitoris. Menses too early, too profuse with pain extending from stomach to small of back. Small of back is a technical term. Actually, this is at the level of L5 vertebra. This is the smaller back position. This is back portion. So to start with the cervical vertebra, 7 cervical vertebra, then 12 thoracic vertebra, then 5 lumbar vertebra. The 5th lumbar vertebra is the place is called small of the back. Calcarea curve for leukorrhea. Generalities. Patient generally fat, fair, flabby. Sweat too easily and catch cold as a consequence. Pale, weak, timid, easily tired. Great longing for eggs and indigestible things like chalk, charcoal, burned clay, etc. Particulars. Leukorrhea of infants before puberty, before and after menses, milky leukorrhea with burning and itching of vulva. Cervical leukorrhea, discharge albuminous with great lassitude and debility, sharp stitches and burning in cervix. Increased discharge after excitement. Voluptuous sensation in the genitalia with copious and oft recurring menstruation. Worse by day, during urinating, after exercise. In the world famous book of Homeopathic Therapeutics by Dr. Samuel Lilienthal, indications for more than 100 remedies were described. Interested viewer may please consult. Actually, this is the book from doctors all over the world. Very often referred to this book, this Dr. Samuel Lilienthal. Now, these 10 medicines only I have discussed with my, the generalities were not there, only particulars were there, but there are more than 100 remedies indications, all indications mostly related to particulars. This division of generalities particular is my own creation because homeopathy go by both the things, generalities as well as particulars. Thank you for listening and viewing. With this video ends. Any trouble, you feel any trouble, please write in the comment section. I will certainly respond.